Okay, now we're live on all platforms. So, welcome back to Coach Connect. Here's where we explore the stories and strategies and insights from trailblazers who are transforming the world of coaching and well being. What drives their success? What fuels their passion for helping others? We're here to uncover their secrets and share them with you. The show is brought to you by Vibely.io, the all in one coaching platform designed to empower coaches with tools, resources, and support they need to thrive and help their clients achieve meaningful, long lasting growth. I'm Dr. Diego Salinas, your guide on this journey. As a neuroscientist, physician, and health coach, and co founder of Vibely, I'm committed to celebrating the incredible work of coaches everywhere and helping them unlock their full potential. So, together, let's dive in deep into what makes coaching a powerful change of force. Really honored to have here today Neal Sundberg with over a decade of experience in mental health counseling, coaching, and healthcare innovation. Neal is a recognized leader in health and wellness coaching. As a former senior director of coaching at Headspace and Ginger, Neal played a pivotal role in scaling 24/7 mental health coaching platforms from 500 to 8,000 weekly sessions, while significantly improving member outcomes and experiences. Now the owner of Neal Sundberg Coaching and Consulting LLC, Neal partners with healthcare organizations to integrate coaching into care models, build high impact coaching departments. This includes work with a Connecticut Addiction Counseling and Coaching, where he provides one on one coaching and leads the effort to incorporate health coaching in the recovery model. He also serves as an advisor board member for NYU's Coaching Technology Summit, where he leads initiatives to spotlight health and wellness coaching as a critical component of holistic care. Neil's passionate about using coaching to transform healthcare and excited to share his insights and build scalable coaching solutions and foster innovation in mental health services. And as of today, Neil, I know you announced he's now the director of coaching at Brightline, a company dedicated to transforming how children and families get mental health care they need, with coaching playing a pivotal role in supporting this mission. Neil, so honored to have you on the podcast today.
Yeah, it's so honored to be here. It's funny with my podcast, I'm usually on the other side of that. And so I'm like sitting here, I'm like, should I smile? Am I smiling? And like, I'm like in my head about that, but really just so glad to be here. I love the work y'all are doing at Vibely and just honored to be a part of this.
Yeah, we're one big coaching community. I'm glad I've met you in this community, Neil. And so, as we get started, you have a very extensive background, but kind of curious your little personal story, how you got into kind of the world of helping others, therapy, coaching, kind of a little bit, kind of your journey, a little more how you got here.
Yeah, love the question. My journey, I'll start at, I was a business undergrad and going through college, there was a lot of things happening in my life. I experienced some pretty significant loss. Parents went through a divorce, and just college is one of, I think, those times where just it's a lot. You're like first time that you're really on your own. And so I think through some of my own mental health challenges that I was experiencing, and also due to them, just thinking about like, hey, what even am I doing with my career? Like, I want to do something that feels meaningful, that feels really rewarding. It ultimately led me to, I graduated with my business undergrad, but then I pursued becoming a mental health counselor, got my master's degree, and started working in the therapy field. And so it wasn't until I got a job as actually a coach, which was a little bit loosely worded at that time, but at a residential supportive housing unit where I was working directly with young adults who were transitioning to independent living. And then I found Ginger, which Ginger was this online little startup that had postings for mental health coaching. And I was like, what is mental health coaching? Like, what does that look like? So reached out, applied, got into the coaching world. I was very fortunate just how things worked out, was able to move into a management position pretty early on, got to take over as a director of coaching there when we were still a pretty like small team. We're like 20, 30 coaches at the time, and we got to scale it to close to a 200 person department. So was really excited, just thrown into that. So I was very fortunate that was the case. I was also very fortunate that Ginger merged with Headspace, and many people have
Hmm.
heard of Headspace. It's very much this kind of brand that people know and love. And so that really opened up truly a lot of opportunities for me. I did leave Headspace about 4 or 5 months ago now. I was doing some consulting work, I was doing some private coaching. And then I decided a full time position was something that I wanted to pursue. And as you mentioned, as of like 3 days ago, I'm in the thick of training with Brightline, which, as you mentioned, is a company that has a mission that is really near and dear to my heart. I'm someone who, fun fact, is going to be a father at the end of June. And so the mission to really support families, parents, children is one that so excited about, and to be able to use the knowledge that I have and the power of coaching to support those is just something that I cannot wait to really get going.
And Neil, and really congratulations to you and your growing family, and
Thank you.
definitely a topic close to my heart too. From pediatrics, part of my reason I found coaching accidentally was trying to help parents out in a way. I'm like, how can I educate them without diagnosing them? How can I support them without giving them medication? And that's how I found coaching. So wonderful to see more groups of people getting support they need. And a lot of her parent coaching, I think, is supporting their own self care. A little hint of advice is coming up. There's so much to do for a kid. It's that putting the mask on yourself first, but maybe that'll be a next episode we explore together.
Yeah,
Parenting coaching.
absolutely. And as I get closer, I mean, we were talking a little earlier, right before this episode, like I might be calling you 1 a.m., like, Dr. Diego, what do I do? But just, yeah, super excited to just have that support, as well as just learn alongside my work at Brightline, how to be the best parent that I can be.
Yeah, and I mean this. Please call me if I'm awake. I'll answer back.
I will take
I'm a
you up.
nighthawk.
Careful
um,
what you wish for.
yeah, no, it's funny. I kind of started coaching because of that.
Mhm.
Some people were asking for help, my friends and family. I was like, why can't I just for everyone else besides friends and family? I won't
Yeah.
diagnose them. I just help them out. Um, so Neil, so maybe we'll start off with like the $1 million question. I'm sure you get asked a lot. I think a lot of coaches get asked this in training. A lot of clients ask this during a discovery call. And you mentioned you have a background in therapy. So when people ask you, "Hey Neil, what's the difference between therapy and coaching? What is mental health coaching?" How do you address this this tough question?
Yeah, it is. It's funny. It's a question that I'm asked a lot, and it's a question that I think is not an easy one to answer. But I'll start off by saying that, and this is a little bit to absolve me in case I have an answer that's just not like completely on the money. But if you were to ask, let's say, a therapist, let's ask 100 therapists, 1,000 therapists, like, what is therapy? You're going to get a whole range of
Mhm.
different answers. And a lot of that is because the individual work we do, human to human, is complicated, it's complex. But also, there is so many different types of therapy. Someone may be oriented more so in like a psychodynamic lens, which looks a lot different than someone who's maybe more likely to orient themselves in cognitive behavioral therapy or EDMR or solution focused therapy, which ironically, if you look at kind of what solution focused therapy is, you will see probably the most overlaps with that of coaching. And so I say that a little bit just to kind of like set tone. What I might share and how I view coaching might be slightly different from someone else who might have a little bit different of an orientation. But I think what you hear most people say when they're trying to compare the two is coaching is much more primarily, I'll say, focused, because we can turn our attention somewhat to the past, but primarily focused on the here and now, as well as looking towards the future. It's where I'm at, as well as like where I want to go. And so a lot of it's like trying to unlock what are the resources that folks have, what are the strengths that folks have, and then help them side by side with them to really align on a future that aligns with their values, their goals. And I think the easiest way that we can like draw that line in the sand is there are clearly things that coaches cannot do that therapists can. So diagnosing being one, processing of trauma being another, a lot of just processing in general. Like I think you can go to therapy to maybe really understand yourself a little more, why certain things from your past now impact your current state. Um, and then the last thing, again, just like the really clear line that I think we can draw is around severity or acuity of
Mm.
symptoms. Someone who's coming in who's experiencing really significant panic attacks, they're experiencing maybe self harm, suicidal ideation. Likely they need support from a therapist, a psychiatrist. And then as their symptoms maybe stabilize, we can consider, and we'll talk about today a little more, the possibility of adding coaching into it. But I think like that's really how I would draw the line. But there is a ton of overlap, and I think I want to call that out to say that is okay that there is overlap. There are plenty of professions, especially in the medical field, where that overlap exists, and we don't have to completely separate ourselves from two types of professions.
Yeah, great perspective starting off that the answers are different. What is coaching? What is therapy? The different therapies, different modalities, and so when you're comparing them, it's where do you start the comparison? And I think the brain's a fascinating organ for many reasons, but it's one that many people study from different directions. People go, psychology and neuroscience are both looking at the same organ,
Mhm.
right? A neurologist looking at seizures looking at the same organ, right? And so we're looking at a similar thing and with different perspectives. And so there's this overlap and also some trans diagnostic things we can all share from. But I really do think the important differentiation there is the diagnosing part, right? Therapists are trained to diagnose and then provide treatment for those diagnoses that are appropriate, right? You mentioned often the severity. And coaches can walk you through helping any part, whether you're diagnosed or not, through those changes. I've heard so many different versions. I've heard people say, therapy is archaeology, looking at the past. Coaching
Mhm.
is architecture, building for the future, right? But you're right. One is more looking tends to have more of a looking at the past, restructuring, understanding that, and then coaching is really how does that past really move forward. But a lot of people say, wait, I do a lot of behavior change in my coaching too, my therapy too. DBT is very behavioral based, right? So again, definitely a lot of overlap. And I'm curious if ever clients go, wow, that was so therapeutic. And I've said,
Yeah.
listen, I'm not a therapist, but I'm glad that to me that means you're feeling better,
Yeah,
right? Yeah. And so you
totally. Yeah.
mentioned, oh, sorry, go ahead, Neil.
Well, I
Yeah.
was just going to say it is interesting. Like CBT, cognitive behavioral therapy, like you said, DBT, like coaching takes from all of those skills. And
Yeah.
that's historically been the case. So you have even motivational interviewing, like Rolnick, Miller, like they created this, two psychologists who created motivational interviewing specifically for substance use.
Right.
And then now, really, what they've tried to do and have been largely successful in that is like, what are the other applications? Coaching absolutely is a great application for motivational interviewing, and I think we're seeing a lot of that. Like I said, solution focused therapy, I'm pretty sure like the miracle question came from solution focused therapy. That's something often utilized in coaching. CBT and cognitive behavioral skills, there's no reason why a coach can't help folks to really understand that dynamic, that your thoughts impact your behaviors, impact your emotions, and having that understanding and really like working with them on that, like,
Mhm.
yeah, absolutely in the realm of coaching. And so I think we'll start seeing more and more and pull from different professions, not just therapy.
Yeah. I actually had a coach I saw last year. He was a therapist in Colorado, but out of Colorado did some coaching. And so
Mm,
when I met with him, they'll give you, as most coaches, we know, a discovery call. What is this? And he didn't know I was a coach as he started talking about what he does. And I found interesting how he's described it. Now, he's a therapist, so his wording will be different because he does have
mm,
different resources. I think interesting about coaching is we have different backgrounds, right? So even when I'm coaching someone, I'm not their doctor, but I have different educational backgrounds and resources I can provide them. I'm not
right.
going to diagnose them, but I can point them in different directions and help understand thought processes. So for his wording, I think I want to be clear, he was a therapist, so I think it's different for him saying it.
Mm,
He said, coaching allows me to use the science of therapy without being limited by a diagnosis of therapy
mm, like
or
that.
some of the tools of it. And
Mhm.
so that was like an interesting perspective that he can use because he understands that field well. I can't say I
Yeah,
know it all well. But
totally.
yeah, this is transactional approach that some of these things work regardless of diagnosis. So like DBT is a doctoral behavior therapy was a therapy that for those unfamiliar, started Marshall Linehan. She herself had borderline, which is a diagnosis of a lot of emotion dysregulation, up and down swings. You
Yeah,
can. I'm being very general here. And she was saying, hey, some of these CBT things don't always work because I can't always think things through when I'm so dysregulated.
right.
And I went through some of these trainings. Interesting enough, we all get dysregulated. If you ever cried or been very happy and laughing, it's theory of dysregulation. Just some people have it more or less often. So some of the skills she developed really do apply to most people. Just what people need to know. Some populations are more benefiting from them, right? So you can use some of these tools in different contexts, and kind of like we talked about a little earlier. you don't always need to have a panic. Well, let me say that talking for later on. But yes, it is a nice, interesting overlap of um, using these. I think as coaches, it's really important to also, when we do talk about those things or these models, right? Sometimes the client might come in talking about, hey, I want to work on my anxiety. We might borrow from models, but I think the brain is so complex. There's no one model that will encompass it all. So the
Yeah.
more tools we have, the more different ways of approaching it, of these abstract concepts, the more ways we can help our clients understand how their own brain might be working and their own unique model of their well-being.
Yeah. I remember too, like when I moved from being a therapist and being fully invested in coaching, I remember thinking like, I have all this information like stored about CBT and all this psychoeducation around the science and all these things. And I'm like, I can never use those anymore. Or like, I was very big into kind of the intersection of philosophy and psychology and really gravitated towards like existential psychotherapy and Irvin Yalom. And I'm like, oh my gosh, I can't use that anymore. And that was something that I really loved. But then, like, when you break it down, like, there is no reason why we can't utilize meaning and like Viktor Frankl's and Friedrich Nietzsche and like the if you have a why, you can kind of bear with almost any how. Like, you absolutely can incorporate those things into coaching. And I think for me, that was a revelation. I think that took some time, and it took me going through an MBHWC program to kind of realize and being like, oh wow, these things are very much aligned, and I absolutely don't need to put those things to the side. I can utilize the skills that I've developed over the years to be a better coach. And I think that's and I in the beginning, and why I kind of framed the difference of therapy and coaching as like uh, with that preface is I would hate to see folks who are therapists that get into coaching be limited by those things and be so rigid in their roles. Like, there are clear things that are out of scope and we want to hold those lines, but there's also other things that like we can really utilize. And I really want to make sure just to continue to convey and have us embrace that.
That's a great perspective. 'Cause I think so much in the training programs, I see students that I'm helping train, there's this like black and white thinking about
Yeah.
this, or there's either fear from the maybe the student who doesn't have a mental health kind of background or healthcare background. And they're like, I'll say, well, Diego, what if my client cries? I'm like, well,
Mhm.
with enough time, they will. What if- they go, they say, oh, I heard students say, sorry, that's more psychology. It's more of a, it's not a coaching topic. And I'm like, they're all topics related, and there's people who do have different backgrounds, whether
Mhm.
healthcare, mental health backgrounds. And so I think the creativity and coaching, the magic of it is in that unique creativity and the background resources we bring to the table. So if you have those resources, how as a coach can you bring them forward in a coaching directed way, scope of practice, and that really involves not just the initial conversation, then your contract and all that, but also ongoing. Remind them, hey, I know I have these dual hats because they'll ask you questions. You're this. What is this? Really say, reminder, I just because I'm a doctor doesn't mean I'm your doctor. I can help you think through this, but I'm not diagnosing you. So also kind of allowing them to be a continual discussion around this as well, so that you can kind of help navigate. And each coach will have that unique point where it's out of their comfort zone. I think as a coach, it's really important to know where, as any healthcare provider, frankly, or well-being provider, the most important thing is to know when you need to help for someone else. That's the most important part as a provider.
Yeah, I agree. And can you imagine? I mean, if you are, say, that person who is working with a coach and you and the coach have built up enough rapport in to the point where you even feel comfortable to be really vulnerable, to cry, and then the coach's response is like, oh whoa, we're I can't go there, we have to stop. Like, the that obviously would be pretty jarring of an experience, and certainly not one that anyone would want to go through. And so yeah, I mean, I think just be open to someone's is presenting with emotion, they're being vulnerable, to sit with it a little bit and allow them to express themselves. Obviously, like, as you get better as a coach, you'll find ways to really organically turn your attention towards the coaching, but this is a human to human relationship, and being able to sit in that, I think, is something that we all should be doing.
Yeah, yeah. I think it's there's I see me and myself early in training. This a bit. in medicine, you want to solve and fix all the problems. It's
Yeah.
like, no, no, it's okay, it's okay, it's okay.
Right.
Right. This kind of rose retrospection. And then learning that, actually holding space, right? Name entertainment, letting actually reflections for all the coaches listening, reflections help validation. It helps lower when you feel seen and heard, people feel more calm in the limbic system, the part of the brain that relates to emotion. So allows more frontal cortex activation, which allows more reasoning to come in. So actually,
Mm,
sometimes addressing the emotions is itself enough to help lower that kind of that frazzled state, or kind of come back to a grounded place where logic can start balancing out again and start working with the emotions. Emotions and reasoning aren't separate too. I sometimes have to work with families, and sometimes more often the dad than the mom will say, "Well, my kid's not emotional. I'm not emotional." I'm like, your drive to be the best company or the 1% is not based in logic. Logically, you can't. Not most people will be 1%. That's an emotion.
yeah.
Your feeling about your partner's emotional outburst is an emotion. And that really these things work together. It's not all or none. Yeah, we don't have to solve right there, but just holding space for them. I've seen also clients sometimes then after a session that was emotionally intense, send me a message. Hey, sorry for today. Sorry for crying. Sorry for
Mm,
this. And I always say, I can't accept that apology. You have nothing to apologize for. We're here for all of it.
totally. Yeah. And that must feel great. And I mean, I could go on a long tangent too about
Mm,
masculinity and inhibiting emotions and all those other things. We'll save that for another conversation.
yeah.
But yeah, it's so true. And how we show up in those moments like is so important. And just like how you did that with like not accepting kind of the apology, I'm sure the person is just that must be so nice to hear that.
Yeah. And for all coaches listening, frankly, it was a little bit of a learning process. I was
Mhm.
comfortable with healthcare dealing with hard situations, being at the bedside, being in the ICU. So that didn't bother me as much. Like I was used to that in a certain sense. I could be there, but I didn't have always the tools of before it was like, well, here's some medicine we're gonna give him. I didn't have the emotional tools to work with them. And it is amazing if you just sit in that discomfort, if you're not trying to the writing reflex, not trying to correct it,
Right.
how much that it's and that takes a lot of on the coach's side. I want to say who people in training, your own self-regulation. It's
Mm.
okay to feel uncomfortable when someone you're a human. You're gonna feel that pang to want to help them. And then coaching says, how can I use that wanting to help through evidence-based lens? Oh, actually, if I don't shut them up or change the subject, let them explore. That's actually the best way to be compassionate here. Give them that space to externally process, and then we can work together how this moves forward.
Yeah, agree. And to that point too, right? Like when you are a newer coach, like you said, that takes a lot more like strength or like intention as you get more seasoned as a coach, like that'll come a lot more natural. And then you can really just focus in on being truly present with someone. But in the beginning, of course, I mean, that takes a lot of time. And after even the education of an MBHWC program, ICF, it's going to take a lot of coaching sessions to fully feel comfortable being just fully present in the moment with your person that you're working with.
Yeah, and I'd say, first try. I think what's helpful is that when you first try it, you see it actually it works, and so it's a bit
Mm.
easier to become more comfortable later on. You know it's going to be uncomfortable for both of you, but your past experience of it actually helping people out, like kind of name entertainment, really is different. And I think also from the client's perspective, Neil, I'm curious your thoughts on this. I was working with a client one time, and she was saying something. She goes, "Oh, sorry, Diego, that's not a health coaching topic. Sorry about that."
Mm.
And I paused her. And I thought, because I mostly do mental health coaching, and I was like, can I pause you here? Because if you're thinking about it, it goes through your brain.
Mm.
If it goes through your brain, that's where mental health lives. Well, it lives in your whole body, but so
Yeah.
in that perspective, I really can't think of a topic that is not coverable by health and
Right.
wellness coaching. Everything affects your mental health because if you think about it, it's directly interrelated.
Totally. Yeah. I mean, it's grist for the mill, as they say. Like it is useful information, and so yeah, similar to what you said, it's challenge that. Like I don't think there's anything that someone can say that would be really outside, and we want to know that information. Like even if it is, I mean, suicidality. If
Hmm.
someone is scared to share that they are having feelings or thoughts of suicide, we don't want them not to share that because that's quote unquote not within the scope of coaching. We want to create an environment where someone feels comfortable enough. You might even be the first person that they've ever shared with anyone that they're experiencing suicidal thoughts, and they felt comfortable enough to share it. And so we obviously don't want to shut them down there. And we want to make sure that they tell us a little bit more and that we can make sure that they can get to the level of care. So I think it's more so what we do with the information that they provide us and less so about the information that they provide us being out of scope. So it's really just how
Mm.
we engage with that info.
I like how you worded that. It's not it's how the information provided versus out of scope. I like that wording. And we had an episode actually talking about trauma informed coaching, suicidality last year. And one thing that came up, and I do all my discovery calls, I mentioned about confidentiality with my clients. I go, one thing therapy and coaching does have in common is confidentiality. Anything you and I say is between you and I, no one else, right? There's only two exceptions for that, right? And that's by state, could be legally required, but I say, frankly, just morally required for me. I go, if you're actively suicidal or actively homicidal, you're actually thinking of hurting yourself or someone else, not passive, which we talked about before what that means,
Right.
then I say, then of course I'd want to help you get the help that you need there. Don't use the word, I'm gonna report you. You're not reporting, they're not in trouble for this. And so even offering that early on lets them know that you are there for all of it. And
Right.
when those things happen, they can turn to you. And then your job is to then help that next step, get into the emergency services because those are indeed emergencies. Um,
Agree. Yeah.
and Neal, also, we talk about too, so these differences, but I think there's a lot more overlap possible too. It's about acuity, and the reality is there's so many people who need support for both
Yeah.
treatment stuff, but also for preventative things. And maybe for our prevention, let's talk about the complicated stuff, the treatment part, because I sometimes see coaches say, "Well, that person has X, Y, and Z mental health disorder. I don't know if I can work with them."
Mm.
I have a client who's bipolar.
Yeah.
I don't see him on the manic phase.
Yeah.
That's a different story. But with his therapist and psychiatrist, I help with the behavior part, right? So sticking to the physical activity, the socialization, things that help his well-being too, and keeping him in check with his professional development, for example, getting back into the workforce. I've had clients who have a history of different mental health disorders, anxiety, depression. You can still work with them in a coaching related way.
Right.
I've even had therapists. I think I talk about maybe this in how we can refer to each other. I've had therapists refer to me
Hmm.
for behavior change. So clients really depressed, we know depression and movement is very effective, right? So I'll work with them on a movement plan or a healthy eating plan. And then I'll talk about other ones referral the other way. But
Yeah.
what are your thoughts on kind of this like maybe collaboration more is not so black and white. You can still see people transdiagnostically, regardless of
Yeah.
diagnosis.
Totally. And I think a lot of that comes from the stigma of diagnoses. So, like,
Mm,
someone, like you said, who might have bipolar, there are many people, and many people that you don't know have bipolar, and it's very well managed. And there are also, unfortunately, those maybe who don't have that level of care and it isn't effectively managed, and we want to get them into that higher level of care. But to your point, one of the really interesting things when we did the research and the data at Headspace was what we saw with coaching and therapy, and the outcome data was coaching was comparable, if not the same as therapy outcomes. But where we saw the greatest outcomes was actually when you had coaching and therapy combined. So if a member was in both of those services, that is where we saw the best treatment outcomes. And I think the reason for that, as you alluded to, is it really, I think, allows the professionals to really hone in on their strengths. So you might have a therapist who's able to dive a lot deeper, talk about more of that, the healing, the processing, the trauma, make you have or gain like a greater understanding of yourself. And then from that, who is it? I think it's Lori Gottlieb, who is author, psychologist. She says insight is a booby trap. And what she means is that it's great that you found insight. That is a huge part of therapy. But unless you're actually making changes, nothing in your life is truly going to change unless you're taking action on it. And so, again, can go deeper with a therapist, and then a coach can then support with collaboration of a therapist to help support the different behavior changes in your life, which can look like a lot of different things. But the reality is, mental health is something that is very practical. And I think you kind of talked about a little bit where it's been a little bit mystified. But the reality is sleep, diet, exercise, meditation, like all
Socialization.
right, like all of those things are things that we can support and help you really implement in your life. And yeah, so I think a coach's role absolutely has a role in mental health. And I think utilized together with a therapist, with a psychiatrist, we can see the greatest outcomes, as the research showed at Headspace.
Yeah. And both of those too, if the studies show that biggest predictor of outcomes, whether therapist or coaching, is
Mm.
therapeutic alliance.
Yeah.
Is the provider passionate about, and from the provider side, it's the provider passionate about what they are working in. So when I coach mental health, I've done up to 2 3 hour sessions.
Mm.
I'm not as passionate as weight loss, so I prefer to do more of this, right? So I have better therapeutic alliance with my clients. That's where I think autonomy and letting people, something we try to vibe. We try to support people to do what's their passion. And you allude to the mental health and physical health component. I was one time on a panel and they asked me, "Hey, what's the difference between mental health and physical health?"
Mm.
And I think I said this before in a different episode, but I said they're not different.
Right.
Last time I checked, the brain is in the same sack of skin as your heart, as your kidneys, as your stomach. I'm glad we're talking about this part of the bag, but it's
Right.
all in the same bag, right? So working on any one part can be helpful. I think people when they are in feeling stuck or in gridlock, right, or frozen, you can go, I can know how I can make my mental. I don't know how I can improve.
Mm.
But since it's all a system, we often send that correlation when one part is broken, it kind of all cascades down. If it's correlated, it can also cascade up, right? So then working on any other part can use a little more self-care, a little better sleep, or a little more exercise, right? Or a little better nutrition for you will make you feel better. So it helps mental health as well. That these really could go hand in hand. And you mentioned, I think it's dual role. One of my clients, she told me, I love that I have both because with therapists, I unpack stuff and I kind of think about what's going on. But with you, we figure out what to do with it.
Yeah.
And you alluded to, I in medicine, we should say like awareness, right? There's a saying in medicine, some things are sufficient, but not necessarily not sufficient. And so awareness, like you're mentioning earlier, of what's going on, these patterns, is definitely necessary to make change,
Yeah.
right? You have to accept where you're. You have to accept where you're starting from, or your GPS to know where you're going. But awareness can be a double-edged sword at the beginning of change processes because people can at first be more aware of how stressed they are.
Yeah.
I'm much more aware of how disorganized I am trying to work through this, right? Like, so during awareness periods is not always easy and it's not sufficient for change because awareness by itself could become self-pity if it's all you do.
Yeah. True. Yeah, absolutely. I like too, you mentioned, I forget how you described it, but the kind of idea of like, I forget the book. I think it's actually probably called Upward Spiral or Downward Spiral or one of those. But that idea that like mental health oftentimes is in downward spiral, and it starts with kind of taking less care of certain things, and it becomes more cyclical, and then you're not taking care of your sleep, you're more stressed, now you're starting to eat more fast food, now you're starting to exercise less, and things just kind of incrementally get bad or worse. And then on the flip side of that, kind of how you address it, what it goes into is talking about how you can create an upward spiral. And
Mm.
the same way you kind of got to the point in which you're at, you can do and make those small changes along the way. So it doesn't mean you all of a sudden are like really on top of your sleep, you're exercising 5 days a week, your diet looks like perfect. It's how can we make small changes? And this aligns with which is I think in cognitive behavioral therapy, which is behavioral activation, the idea like taking action to shift emotions.
Yeah.
I feel like all of those things are intertwined. And I think as coaches, and what I would often do when I was a coach at Ginger was provide that psychoeducation so that people can stop thinking so big picture and it's like start thinking small. Like, what are the little things that I can do to get out of this quote unquote rut that I've now kind of found myself in?
Yeah, that's a great talk about earlier how psychoeducation, psychology, and neurology or neuroscience are in the same organ. I had the same kind of education for my clients. I say from a neuro perspective, right? So I'm
Mm,
like, sometimes you want to do New Year's January 1st. I'm going to work out every day, eat only organic vegetables, and sleep this. And that's a lot of just plasticity to do all at once, right? So it's like trying to create 5 roads at the same time with a small pit crew.
yeah.
You want to just put the idea of you see these pictures that says how to get to a long goal. If you say look at a ladder, it's like a
Mm,
three-story building, right?
right.
Do you want a ladder that has 3 rungs or a ladder that has 30 rungs?
Mm,
Which is easier to climb? They both have the same endpoint,
right.
but the way to get to big goals is actually by making smaller steps,
Yeah.
right? That behavior addiction. And then even knowing when I even learned that behavior activation, that actually moving the body will move the mind, right? Or that motivation actually comes from long-term behavior repetition because it's energetically more favorable
Right.
and you get the benefits of the things you've been doing for a month now. After eating well for a month, your body wants it more. So
Right.
this kind of aha is saying, oh, the best way to get motivated to go to the gym is actually just go to the gym. It's not the other way around. So some of that education demystifies things, or even this idea of self-sabotage. I'm not saying it doesn't exist,
Mm,
but I sometimes see clients kind of self-flagellate a little bit, saying, "Ah, what's wrong with?" And like, no, just change just
right.
takes time. Those proteins need time to go to the receptor cells and
Yeah.
make those things. There's a time lag here. It's not that you're a bad person, just that's how the mechanism works. It's not a movie where it's 3 minutes later you have a montage and everything is fine.
Yeah. No, 100%. It's a great call out. I think, like you said, psychoeducation, there's so much that we can. It's funny when you initially said the latter thing. I'm like, oh, three would be easier. Then I'm realizing we're talking about the same height ladder. Obviously, that would be a lot harder. And two, it brought up the idea for me, which again I took from my therapy background, which is like a fear ladder, which is very similar. Like I'm deeply invested in like helping support people who have social anxiety or get really nervous, especially like for settings like this, as someone who really grew up on that. And one of the things I would do with folks is, yeah, finding what is the, let's say, number 10, the thing that is most scary, right? Is that presentation that we're going to do in front of hundreds of people. Like that's what we want to get to. But while we're trying to work our way up, while we're trying to like strengthen those muscles, like we need to take those small steps. And those small steps, like in between, might look like I'm gonna talk to a cashier, ask them how their day went, like something which gives a little bit of anxiety for some folks, and then slowly try and like work our way up, and then you see like nothing terrible typically happens, or it's very rare that that's the case. You start getting your footing, you start really strengthening that muscle, and then get to a point where you feel at least a little bit more comfortable. I mean, I
Yeah.
feel more comfortable now doing these types of things, but I get nervous before them still. Like, but you start getting going and you kind of forget about it. But there'll always be like a little bit of nerves,
Hmm.
anxiety, social anxiety, but you start getting used to kind of that feeling and don't kind of allow it to get into those cycles. And then you start thinking, oh my gosh, what if I do this or what? And then it just like creates that, yeah, cyclical kind of negative thinking, which leads to more anxiety, so on and so forth. So
Yeah.
yeah, for sure.
Great example, Neil, of like how behaviors change your cognition. I have a client who was like, "Well, how do I want to not feel X, Y, and Z when something happens?" I was like, "I can't guarantee you won't feel something. It's a primary emotion." In this case, it was if his sister asked for money, he doesn't want to feel it being used because all he calls is for asking for that. I'm like, if that's all she's doing, can't promise you won't feel that way. What you can work on is what you do with that emotion and that feeling, and what behavior output will change. And
Yeah,
it's like you're saying that eventually, if you change the behavior enough, that primary feeling will change because you get more used to those things. And it's not that it will necessarily go away right away. So it's like, oh, I'm still nervous. Yeah,
yeah,
but with the nerves, you're still go ahead and executing, right? Bravery
yeah,
requires fear. So it's okay to still have those emotions. You see yourself work with those and still not be limited by them. It diminishes them and you can work with them. So then result is saying, how can we work on the behavior output with awareness helping us make that change? And maybe going back to, I think that we're talking about behavior so much. I want to talk about this concept of empathy and compassion that
mm,
I think we're dancing around. This is how I've heard or thought about it. It's a very common thing. So let me define a few words. I've heard this empathy being the ability to understand a perspective. I can see if that happened to you, that would be sad, right?
Mm.
But compassion is that plus either alleviating suffering or improving condition, right? Like I see that happen, and so I want to help you out. And so empathy, compassion kind of requires empathy, but it's different. So the difference between empathy and compassion is action. That's my slant rhyme. Compassion requires action, right? So if you see someone get hurt, fall down, you're like, oh wow, they scraped their knee. That would hurt. If you help them out, get cleaned up, give them a little Tylenol, that's compassion, right? And so this, I think, reflects to self care too. Self awareness is really important. That's self empathy. And if all we do there, we get into like could be just kind of self pity. So some of my clients work on self compassion. It requires action. So I'm very compassionate. I know myself.
Yeah.
There's no action there. So my client work, I say, what's the action you're taking to show compassion? The action could be getting a glass of water.
Yeah.
Did I do an action for myself? Did I go outside and feel the sun on my skin for a minute and a half?
Yeah.
Right? If there's no action, there's no compassion. So kind of train that awareness is there. How can we build the action into it to then kind of come back?
Yeah, I like that. And like similarly, like sympathy isn't the same as empathy. And I like that too, because it puts, like you said, both as coaches, how we support. It's one thing to provide a reflection, but to really be in there and say like, hey, we're going to work together on this is one thing. But I don't think I've ever heard that talked about in that way with self compassion. I fear that I'm going to veer off by saying this, so feel free to bring me back. But it did make me think about like there's so many conversations right now around AI, and there's coaches who are concerned with like AI taking over a coach's role and things like that. But I think what you said right there, like that is what AI is never going to be able to accomplish. And it is very good. I will not deny that it is very good at doing the base skills, the foundational skills, honestly, better than me, I feel like at this point. Like I play back and forth with these AI chatbots,
Mhm.
and their motivational interviewing skills are really good. Their ability to even provide reflections first before they then give me kind of like actionable steps and things like that. So it is very good in that nature, but I'm not communicating with a human. I don't feel like someone has empathy. And like there's something so powerful to just be met in the moment by an actual human that you feel like truly understands the experience that you're going through. And that's something I mean, I wouldn't love to be proven wrong because I don't know what that would entail or lead to. But I'm a huge advocate for AI to scale care for certain reasons, but I don't think it'll ever take away that need for one-to-one human connection and human coaching.
Yeah, let's go on this path for a little bit, and then we'll come back. But I think we could probably have another episode just on that
Yeah,
too. And fundamentally agree, there could be great tools, right? So I've been using it when I've been going
totally.
through stuff like, hey, I have ADHD, so I kind of think in nonlinear ways. So I was going through a hard time, and so I was like, just kind of using to kind of voice notes, right? And
Mhm.
then would organize them a different way. So that was helpful to think about it. But then, so that would help me that when I go to coaching or go to my therapist, I have a different way of talking about it. Because you're right, you cannot replace human empathy without humans. It requires humans to have human empathy. And if I can share a brief story that kind of does it to our audience, right? That reflection, that being seen, this validation goes back to it I learned from DBT. So when emotions are high, we see a lot of activation of the limbic system, that part of the brain, the structures that are responsible, we think, for emotion regulation. And then when a lot of blood is going there, we see less blood going to the frontal cortex, a part that's more executive functioning, handling emotions, reasoning. Let's put it that way, right? And so there's like, what helps low? We notice there's like a seesaw effect. If there's too much emotion, the frontal cortex goes down. And if we can bring this down, we can find more of that balance again.
Right.
One of the most effective things to bring us down, there's some little things you can do for breathing techniques, but for the mental things you can do is actually just validate someone. It does
Mhm.
not mean you agree with them, right? When you reflect to a client, hey, it's really important to have legacy. You don't have to have that same value.
Right.
You agree. You basically say, I believe what you're saying is how you're feeling.
Yeah.
Now, and doing that is now complicated as art to doing that well. But you see that then in fMRI machines, people's limbic system will start lowering down a little bit, right? They start, their blood goes less. And this applies, I want to share a story time. This applies in ways I never would have thought. I was one time helping take care of people in elder care and kind of residential facility. And I was helping with a lady who was in her 70s, had dementia. Overall, it was pretty peaceful. It's kind of time for the computer or TV, excuse me, make sure she gets the medications, kind of she's doing okay. But then the issue was when transferring from daytime to nighttime. So going from the living room to the bedroom,
Mm.
all of a sudden she would get super combative,
Yeah.
start biting people, scratching people. She didn't want to be moved. Um, she had incontinence issues, so didn't want to be changed, right? And it became multiple providers had to come into here, kind of unfortunately kind of hold her down and do some of these self-care things she wasn't able to do, right? And like the third or fourth night of me, being there as helping hand, I'm helping because she's trying to scratch everyone. I'm trying to keep her safe, keep us safe. And she's there like literally looking me in the eye trying to bite me.
Mm.
And instead of saying, everyone else was saying, "You're okay." Let's call her Miss Jones. "You're okay, Miss Jones. You're okay, Miss Jones. You're okay. You're okay." I literally just looked at her. I was like, "You're really frustrated that you don't know who we are, what's going on, and you wish this wasn't. You were independent."
Yeah.
I swear to you, Neil, she was like this anger to be like, I've never looked her in the eyes in that way. For
Yeah.
10 15, she completely stopped.
That's amazing.
Right. So validation, that human empathy works. The computer can help the tools organize it, but why would we not use this wonderful tool that's already innately built into us?
Yeah, love it. Beautiful
Yeah.
story. And those, I mean, I shout out to all of those who do some of those jobs in group homes and otherwise. I know early on in my career, it was an area that I worked in and really difficult jobs. But I think what you highlighted too is just to slow down and just be present and provide that level of empathy and compassion, and how important and how transformative for someone to receive that can be.
Yeah. And another thing to kind of go to action, maybe go back to the action part. And then hints for other coaches too. Oftentimes we're feeling in a rut mentally. What can you do? Nothing. We lose creativity for solutions. So I make a pact with my clients. I go, when you're feeling the hard times, when you ask yourself, what can you do? The answer can be anything except for the word nothing.
Mm,
Again, that self-compassion. Can you grab a glass of water? Can you call a friend? Can you watch a movie? Just there's
yeah,
always something. Just as long as you commit, the answer is not nothing.
right.
That's taking that first step in activation. And we have about maybe a little 10 minutes, over 10 minutes left. One more thing I want to talk about, and then we have some questions from the audience too. We want to field that people have been asking about. So, one thing before we go to the questions is, um, I think what's also powerful for coaching is that there's no diagnosis actually.
Mm,
That it's by definition, therapy requires a diagnosis, right? If a therapist is not diagnosing you, they can't bill insurance for that visit, right? And so if it doesn't fall into one of the categories, they might say adjustment disorder, not otherwise specified, but it has to be something,
yeah.
right? And so the nice thing about coaching, I think, is that you can have a diagnosis, like we talked
Hmm.
about earlier, or also you do not have to have a panic attack in order to work on your stress management.
Yeah.
You don't have to feel suicidal to work on resiliency,
Yeah.
right? You don't have to have ADHD to want to improve your organization.
Yeah.
So now we can help people from all parts of sick care model, the transition, as well as the optimization model. If therapy goes from function to dysfunction to function, coaching from function to optimization as well. Really, part of therapy doesn't often, because of many limitations of the system, doesn't really go in this direction.
Yeah. And I think, I mean, it's been a while since I looked at this data, but last time I checked, I'm pretty sure if you they show like from the onset of mental health symptoms to actually getting care is like something like 10 years, which you think about, obviously in those 10 years things are likely without any type of intervention getting worse and worse, and then they're getting to a place where they need higher levels of care. And that is, to that point, like where I think coaching and where my advocacy really lies in, as much as possible, how do we incorporate health coaches into the model. There's a lot of reasons for it. One, because it is a great solution for preventative types of mental health support, and also uh, there is just a lot of stigma with seeing a therapist, undeserved stigma, and we're still working through it. And ideally, that wouldn't be the case, but there is. And the amount of people who came to a platform, let's say like Ginger, Headspace, and when I was coaching, told me, "This is the first time I've ever like gotten any type of mental health support." I mean, I cannot tell you how many times that was the case, but
Mhm.
they did that because it was low threshold. There was technology, they were able to get in, but also because a coach was less stigmatizing. It wasn't like I was seeking out a doctor and needed that help, or a therapist. It was, hey, things are like, I want to make some changes in my life. I want to improve some of my anxious feelings. And so I'm good. A coach sounds like it could be the right fit. And so they get help, and they get help early on. And should it be the case that this is someone whose symptoms are higher, like we are in a great position, especially in an interdisciplinary care model like Ginger, Headspace, Brightline, where we can very easily refer them to in-house therapist, psychiatrist, or find them resources in the community. So I just think there's so much opportunity, and I will continue to get on my kind of high horse and soapbox and just continue to really try and encourage just different healthcare systems and models to incorporate as much as possible health coaching into continuum of mental health care.
Anyway, I can amplify that soapbox, Neil. I think we're all the same message, right? So I think community is really important and frankly, because coaching is newer, almost I've heard this a lot. It's like coaching is like therapy was back in the 80s. There's like, what is this? A little confusion, uncertainty. But you're right, it could be a lower barrier to entry. And actually, one of my adolescent clients was actually her mom was a therapist. She did mostly uh, kind of assessments versus kind of long-term clinical care. But her son was having some issues with stress management, possible panic attack. She actually referred to me because she didn't want to have that stigma. It was kind of easier barrier to entry, and then you can also open more for more things.
Yeah.
Another quick example of when knowing to refer out. I had a client I've been working for many years. One day on the way to work, one day I get a call from him really early in the morning, which people know I'm not an early bird, and I thought it was weird, so I picked up. And he was on his way to work. He's a surgeon, and on the way to work, someone cut him off in the car. He honked the horn to avoid an accident, and the person pulled out a shotgun
Oh,
and
geez.
shot at him. All right. So he called me. He's like, my hands are shaking. I don't know if I could do surgery. What should I do? So we okay, what are you going on? Is there any backup? So we worked through that kind of a coaching way. But then I gave some psychoeducation. I
Mm,
was like, hey, what you just been through is an acute trauma.
yeah.
I'm trauma informed, so I know of acute trauma, but I don't actually treat acute trauma in the way the
Right.
exposure therapies and this. So our goal that day was how is he going to find a therapist? And so
Totally.
he was
Yeah.
an ophthalmologist. He was curious about EMDR, right? So eye movement. He's like, he found college insurance, found a provider nearby. And in parallel, we worked for a few months together.
Nice.
After he
Yeah.
felt the trauma work was kind of where it needed to go, him and I continued on. So we were always in parallel, and then we were there too. So you can really be that referral source for people who aren't sure or who feel there's a barrier there. And really, with education, help them get more access they need, even if it's not you.
Yeah. Great. Great example.
Yeah. So the few minutes left here, we have a question from the audience, Neil. I'm curious if you want to answer this. So the question here, or it's more of a thought, is any thoughts on how to manage a patient slash client when a person is both a licensed therapist and a coach?
When
Provider.
the provider, oh, so like, okay, so it's coming, it's, this is from a provider asking how to navigate it being a therapist and a coach.
Yes.
Yeah. I think yeah, it's tough. On one hand, I think if you are, you need to set the, you need to set those expectations up front more than anything. So if someone is coming to you, they need to know, hey, I am in therapy or I'm in coaching, and make that very, very clear. I think if you are in therapy, you can utilize coaching skills as a therapist, but when you are a coach and you've clearly established that that is your role, that you will always really have to be the coach for that member, and kind of bouncing back and forth between the two, I think just sets an unhealthy dynamic between. So I think just being very clear once you've established it, like that is the relationship you have. If it is the case that, hey, you need to get therapy, you're not now all of a sudden this person's therapist. You likely should refer out to a different therapist. You can continue to work with them, but keep your role as a coach. That's how I would see it, at least.
Yeah, and a great perspective, and I think is where that scope of practice, right? So if you have any dual roles, right? Physician and a coach, nurse and a coach, therapist and a coach, right? Really that discovery call being important and your contract too, that states it too. And then that kind of continual work as you're going to set through the work with a client, your scope of practice, reminding them what you're the other considerations too is your state licensures, right? So often therapy is licensed by state, for example. So you may only be able to do therapy with those people in your same state, and then you can provide coaching for other people as long as you're still coaching and not providing therapy. So it really is, I think, clarifying scope of practice and seeing for you personally what you enjoy, how you want to split up your practice. Maybe you really have some people who have those dual roles who really enjoy some of their therapy clients and choose a few to be those clients that go in therapy, and then the majority is coaching or vice versa. And great point that if you're a therapist, you can use these coaching skills in your therapy. If you're a coach, you're not trained as a therapist, you can't all of a sudden bring that in here. And to not muddy the waters, I even have in my contract, for example, say I'm not a doctor, and this is never intended to develop into a
Mhm.
patient-doctor relationship,
Yeah.
right? So you can say it's not now, and we're not ever going to cross that barrier, right? And if you did, then it'd be a whole new contract or something. But really, for the sake of the client, really um, clarifying that and reminding them too. So I remind my clients, listen, you came to me, it doesn't mean you can't see your doctor anymore.
Right.
So if you're a therapist coach, say, hey, just because you saw me as a coaching doesn't mean you saw a therapist today. You might need to have therapy.
Yeah. 100% agree.
Yeah. So Neil, we're wrapping up here with time. So you have a lot of different things that you're involved in, and a podcast you also host too. What can we find more about your podcast or anything you're involved in, as well as the summit information? Because Bible is actually going to hopefully be there this summer as well.
Yeah, we are so excited to have Vibely at NYU Coaching and Technology Summit. Yeah, I would say, I mean, my kind of base is on LinkedIn. So anything kind of you want to engage with pertaining to me, whether that is my podcast, which is the Health and Wellness Coaching Podcast, add me on LinkedIn. If I see you have an NBC HWC by your name, you get an automatic ad. Um, if not, I don't know you, I'll probably just look at your profile briefly, make sure you're not a bot or anything, and accept you. I love meeting folks in the space, getting to chat with them. As you mentioned, the NYU Coaching and Technology Summit, that is July, I think, 7th and 8th. And historically, that has been more focused on professional coaching. But part of my role as an advisor has been to really try and bolster up the health and wellness coaching presence and like getting Vibely. We've gotten a lot of other young emerging startups that we're really excited about. More than anything, I've developed so many incredible relationships through that summit, and hopefully if you all are able to attend, you'll be able to do the same. I would love to meet you in person. That is actually around the due date of my baby. So I'm figuring out, likely won't be able to make it in person, but figuring out. But yeah, definitely add me on LinkedIn. Would love to connect with folks.
Yeah. Maybe if you don't know him, put in the connection request. I saw you in the podcast. Maybe that way people
That'll
know
help.
where you
Yeah,
came
yeah.
from.
I
It's
add
in
most people, to be fair. I'm not too picky choosy, but sometimes there's some red flags that come up.
yeah. So to all our audience today, thank you again for being in front of episode of Coach Connect. Really excited to continue on this season, and wanted to also give a little update for Vibely too. So we're known as a coaching platform, but we are also seeing therapists and other providers come on our platform for HIPAA compliance in their own practice. And so we want to help bolster any solo provider in their practice, right, with the tools and resources communities you need. Because of this, I'm also offering a special discount for anyone listening today who's curious to sign up. If you type in discount code Salinas20, so Salinas is my last name, SALINAS, and number 20, on discount by tomorrow afternoon, it expires, you'll get to 20% off the first 3 months of service, whether you choose monthly or yearly subscription. It's kind of our goal to lower barriers for both providers and clients, to help people make more connections and get the support they need, whether it's in the therapy side or the coaching side or any part of that continuum. So thank you again, Neal, for being our guest today. Really wonderful conversation. We got to have you back on for all these other topics we mentioned: parenting, masculinity, AI, and looking forward to hopefully seeing you in the conference if you're able to make it. Thank you
Yeah,
again for
looking
being our
forward to
guest. Really enjoy the conversation.
it. Awesome. Thank you so much, Dr. Diego. Really appreciate it. Thanks all.
Thank you, everyone. Bye bye.
Bye.
Okay, let me stop sharing here.